Today on Situations and Conversations, we are taking it to the community for a town hall to discuss fentanyl. Thanks to our presenting sponsor, Oregon Health Authority, we're getting to the heart of this drug crisis in our Black and African communities. What is fentanyl? Where did it come from? Why is it impacting us so hard? And what can we do about it? And how to help save someone from a fentanyl overdose. So let's get into it. The situation is serious, and the first of our two-part conversation starts now.
Situations and Conversations with Trey Renee. Situations and Conversations with Trey Renee. Real situations, real conversations. Empowering the community leads to elevation. Entertainment and education, no better time than now.
Noni and I have had many a conversation.
That's right.
Thanks to the wonderful sponsorship of Situations and Conversations by Oregon Health Authority. Thank you all again for trusting us to help get the mission out, the messaging out to the community, and especially communities of color, which is really a big focus for us.
Yes.
And so, Noni, you ready to get into it?
I am very ready to get into it.
I am
You guys
too.
ready?
I am too. Ready?
Yes, yeah.
Let's go.
Yes.
Okay, I am too, because I have to clean. I have to tell the truth. I have ignorance around fentanyl. I keep hearing about this, and I'm hearing more and more about it. And I'm sitting there thinking, what is this thing they're calling fentanyl? So let's just start there, Noni. What is fentanyl?
So first of all, you're not alone. Many people are asking that question. They've had fentanyl. They think it's something somewhere out there that happens in hospitals maybe, but they're also hearing that it's in the community and people are dying, but they have no idea what it is. So that's a good place to start. So fentanyl, Trey Renee, is a medication that's used in the hospitals to treat severe pain. Fentanyl is in the class of medications called opioids. So that's another term that you're going to hear. Now, I like to think of it like this: nuts. There are many kinds of nuts. There's peanuts, there's pecans, there's almonds.
Walnuts, all sorts of nuts.
All sorts of nuts, yeah. Opioids is, you would be like the level of nuts, but underneath that class of medications, there are medications like oxycodone. People have had oxycodone, right? There are medications like Vicodin or Norco, Percocet. All those are opioids. There's also morphine, which everybody knows. And the difference between morphine and these other opioids here, like fentanyl and Vicodin and Percocet, is morphine comes from plants, but it works the same as fentanyl or Percocet or oxycodones. So they're all opioids, and the purpose for these medications, we use them a lot in hospitals and clinics to treat severe pain.
Okay.
Yes.
So it's a pain medication.
Yes, it's a pain medication.
It's a high level of pain medication.
Yes.
Okay, so what does it look like? Is it liquid, pill, powder? What are we talking about?
So the pharmacological or the fentanyl that can be prescribed by a clinician comes in various forms. So for instance, if somebody is having surgery, that's going to be in IV form because you're not, they anesthetize you, you're asleep, so you cannot take it. So that usually comes as an IV. There's also the most common one used in clinics, outpatient clinics, would be a patch. We call it a pain patch. So it can come as a patch. Doctors and clinicians can also prescribe sublingual, which you put under your tongue, and it just melts under your tongue. So it can either come as a liquid for IV, and we're just talking about hospital, clinic, legal fentanyl. It can come as an IV. It can come as a patch. It can come as a sublingual. And I think I've never prescribed a tablet, but I believe there's probably a tablet. Yes.
Okay. Okay.
Yes.
So you made a very interesting distinction just now. Talked
Yes.
about the legal form. We're going to talk about the illegal form in just a little bit. But before we get into that, I have a question. What are the effects of fentanyl? So I know it's a strong, very strong pain reliever, but what does it do? Does it just make you sleepy? Like let's see, I've had Vicodin. I didn't like that. Made me feel ill.
Yes. Yes.
But I felt like woozy and out of it. Is that the same sort of effect that fentanyl has?
Yes. So what you're talking about, Renee, here is side effects.
Okay.
And all medications have side effects that can affect you. And I think of medications as, sometimes, driving your car, for instance, you could end up in an accident. That could be, even though we like our cars and they help us get from one place to the other, but there can be other side effects. So with medications, the same. Tylenol, all medications have potential side effects that could affect you. So in this case, when you take it it can relieve pain, but you can also experience side effects. Side effects for these medications can be, an upset tummy. Some people will throw up. Feeling woozy, that's a very common one. Feeling sleepy, feeling tired, those are called side effects. But there can also be serious side effects. So we know that this class of pain medications, they stop pain by blocking it in the areas of the brain that note, there are places in the brain that can perceive pain or let us know that something bad has happened, we're in pain. And so these medications go to those areas of the brain and block the pain. But there are other areas of the brain that they might go and cause side effects. For instance, there are centers in the brain, we call them respiratory centers, which control our breathing. Right now we are breathing, we are not even thinking about it. It's just happening in the background, the brain is doing its job. And so these medications can go there and block that breathing center. And if that happens, we stop breathing, and an OD, an overdose happens, and that can lead to death. So that's a side effect, a very serious side effect.
I would say so.
Yes.
That's a very serious side effect. We want to breathe. We need that. We need that to live.
Yes. Another side effect that these medications can have in the brain, we also have centers we call them reward centers, but actually we are starting, as we learn more, because science is still learning more and more, we are calling them also survival centers. So for instance, when we get hungry, we eat. When we eat, we feel good. And that's like a reward. But it's also survival because we have to eat to survive, right? And so these medications also change the chemistry in those areas of the brain. And what happens, initially, we take the medication. For some people, they feel euphoria, they feel good, and they want more of it sometimes. But as they take more and more of it, they stop feeling good. It becomes now a survival.
We'll be right back with this OHA-sponsored town hall conversation, protecting children from fentanyl in Black and African communities, after this quick break. Don't go away. Special thanks to our presenting sponsor, Oregon Health Authority, helping people in communities achieve optimum physical, mental, and social well-being. This is the Oregon Health Authority-sponsored episode of the Community Town Hall, protecting children from fentanyl in Black and African communities.
Is that where the addiction comes in?
That's addiction. So now they start craving. They stop even taking care of themselves. They start to see them losing weight because they're not even eating or going to work or they lose their homes because now the chemistry has changed. They're now on a survival mode, and the brain now thinks that to survive, they have to take these opioids. So that's addiction. Yeah. So so that's another serious side effect of these medications. Yeah.
Now, that can be these side effects are whether it's legal or illegal.
Correct. And so when a clinician is prescribing you this medication, because at the time they are prescribing them, you need them, they have to weigh that. They have to weigh those risks of that side effect with the benefits. So they have to make sure that the dosage they prescribe you is not going to stop your breathing. So they have to balance that. Okay? Manage this pain, but not kill you. They also have to make sure that you don't, the time, the period that you take this medication is not too long, because then the risk of becoming, having a disorder, opioid use disorder or addiction becomes now a big risk.
So the length of
Yes.
time will help increase the dependency on it.
Yes.
Okay, and so when you're ready to get off of it,
Yeah.
is that when they do that taper down? Do you taper down with the fentanyl too to be safe, or do you just cut cold turkey?
Oh, goodness, no.
Okay.
You have to be tapered, you have to be weaned off. Because once the chemistry of the brain has changed, just cutting it off will put you into withdrawal. And that will, a lot of people end up in the emergency department because they have these symptoms. Their heart is racing. They think they're going crazy. They think they're going to die. Remember, we talked about survival?
Yes.
They think they're going to die. They're shaking, throwing up, diarrhea, just feeling awful. So, yeah.
Okay, so can we move on into the illegal part? Because there's a whole classification here
Yeah.
that I was reading. So they're called illicitly manufactured fentanyl, IMF.
Yeah. And that's,
What is going on with that? So these are the street drugs, the street fentanyl.
That's where we're here today, right? Yes, yeah. So what happened is the drug cartels, the street drug traffickers, they figured out the chemicals and the chemistry of making fentanyl. So this is a medication that started with to help people with severe pain, but they figured out because it has that addictive nature, somehow, I don't know how they got the formula, and now they started cooking it in their homes, in their filthy homes. I imagine in a dirty bathtub there with a stick mixing all this stuff and so on. Or
That's a visual.
or in the bushes,
Okay.
just making fentanyl. And because it's very highly addictive, that means more money for them, right?
Yes.
And so that's what it's called, illegally manufactured or illegally made fentanyl, IMF. Or, either illegally manufactured fentanyl or illegally made fentanyl.
And okay, so that's out here on the streets. Is the IMF the majority of what we're seeing with these overdoses that have been plaguing our community?
Absolutely, yeah. There may be a little prescription that can cause, but it used to happen in the early 2000s. There was a lot of that because at the time doctors were not very careful, and they started prescribing, without thinking about what they're doing. And so a lot of people ended up being on these medications for too long. And then the doses continued increasing, and then we started seeing people getting addicted. But that practice has stopped. Hardly any clinician is practicing like that now. And so that's why, so at the time we had a lot of overdoses from prescribed opioids. Mm-hmm. Now that's not the case. Instead, now what we are seeing is more of it is a street fentanyl and maybe just a little bit of prescribed opiates if it's in the wrong hands.
Where are we getting it from? Where's it coming from? Like how are these young people or people in general getting a hold of IMF?
So in terms of the where exactly it's coming from, initially I heard that the chemicals were coming from other countries. I don't want to get in trouble naming.
No, that's okay.
But it's coming through, we are on the I-5 corridor, so we are really, really affected all of us all the way up to Canada. So, and we'll talk more about how where people are children and people are finding it, and it's pretty much online. That's where people are finding it.
Online?
Yes.
Wait a minute. Hold on.
Yeah.
I can just go online and type in fentanyl, and somewhere, somehow, I can get it.
And you know why no one is catching it? They are so smart how they promote this medication, this illegally made fentanyl. They promote it, and once they find a victim, those advertisements disappear. So even it's so difficult for law enforcement to keep up with them.
And you know what else? I mean, they're getting so slick. I'm pretty sure that
Yeah.
not just calling it fentanyl, like like that's too
Yes.
obvious, right? I'm sure they're slick enough now where
Yeah.
they're like finding other terms and ways and
Yes,
to get a hold of people.
they're using emojis, they're using code names.
Why do you think it's so popular right now?
So, one thing for the drug traffickers, it's very popular because it's very cheap to make. It's also very light and easy to transport. And I listened to a policeman from the Portland Police Bureau who deals with this and what they're seeing in the streets. They said that to make 1 kilogram of fentanyl, you only need $1,000.
What?
And that kilogram, you can make make 500,000 lethal doses out of that 1 kilogram. And those pills that you're going to make out of that 1 kilogram, you can sell them for $5. So it's cheap. It's difficult to track. It's difficult to. I remember, when you go at the airport and they're the police and the dogs sniffing stuff.
Yeah.
It has no smell. I don't even think dogs can sniff that out. It's not like marijuana. So that's why it's very difficult to control right now.
So if I am a concerned parent and I don't know what it looks like for my child to be or a family member or any loved one, anyone on fentanyl, how does it look?
So
What does it look like on a person?
Yeah. So I've seen pictures of plain fentanyl as a powder. So I imagine the drug traffickers and drug cartels, when they're mixing it, they're using these powders of fentanyl and they turn them to pills. And what they do is they'll take things like cornstarch and make them, they're called fillers, and then they put fentanyl in those. But they also make out of that fentanyl counterfeit pills. So for instance, we talked about oxycodone. So oxycodone is a pain medication that a doctor or a clinician somewhere will prescribe. Mm-hmm. And so they will make a pill that looks exactly like an oxycodone, like a Percocet pill, but it's actually fentanyl, and then it's counterfeit, and then they'll sell that. Another popular one is Adderall. Adderall is a medication that we use a lot for children to help with ADHD, for parents who have children. And so they will make counterfeit Adderall, which is not Adderall, it's just fentanyl in there. So and then another one is Xanax, which sometimes is prescribed for anxiety.
Right.
They will also make counterfeit that. So any pill that has not been prescribed for you by your doctor, and you saw them prescribing it, and you walked it to the pharmacy and got it from the pharmacist, any pill that's not that is going to be counterfeit, and it's going to have fentanyl in it. So if you buy it online, that's what's going to happen. We also find it from what we're hearing, that in marijuana, sometimes they're lacing marijuana with fentanyl.
Is what, a powder form? Because it can't be a tablet or a pill. Like, how are they lacing it?
In the marijuana, I imagine they mix it up with the marijuana. So there's that. I've heard that they're putting it in alcohol sometimes. If people are out partying in clubs, it can be put in alcohol. I have also heard another common drug that's a big problem for us here in Portland is methamphetamine.
Yes.
So I've heard that a lot of fentanyl is also being found in methamphetamine. So almost everything, all the street drugs now can be laced with fentanyl,
Jeez.
as well as the counterfeit pills.
And so
Yes.
you can take it on accident.
Yes.
I mean, really,
Yes,
thinking that you're taking something else.
exactly.
So if someone has been taking fentanyl, but I'm just curious, what are the signs that somebody might be
Yes.
abusing fentanyl?
Yes, yeah. So, when if somebody has an what we call opioid use disorder, where fentanyl is one of them, and they started taking, even if it's a child, and they've started taking, and so you'll start noticing things. For instance, they will lose interest. There'll be problems. They might start skipping classes. They're not eating well, so you might start seeing them losing weight. They're not taking care of themselves, and they're no longer, regardless, even if it's an adult, say somebody had a job, they lose their jobs, they're no longer going to work. So so you start to see signs of somebody is not quite themselves, because they're now abandoning their, just their activities of daily living. They're no longer taking care of those anymore. So those are some of the signs. Now, if somebody is having an overdose, there's also their symptoms that we should look out for. And so with overdose, what you will find, and we're going to have a demonstration here at the end, where what you will find is somebody, maybe they're just slouched, or they're on the ground, they're on the floor. They look like they're asleep. You're trying to arouse them, but they can't even wake up. In the case for us, people of color, Black people, we get ashen. The skin becomes ashen. We also, if you look at the nails, they have a bluish tinge, grayish tinge, and you can also look at the gum. They'll also look bluish. So now that's a severe case when somebody is having an overdose, and they either stop breathing, or the breathing is very shallow, and sometimes they might be making sounds, or they might even throw up. So that's a person experiencing overdose. But a person that's experiencing opioid use disorder, meaning that now they're habitually using opioids, be it fentanyl or other opioids. So what you see is that what we said is that they are no longer, they're craving, so they're spending most of their time trying to find these medications. So if it's a loved one, sometimes they'll start stealing, because they run out of the money, and they gotta buy. So it's problems start to happen at home.
Gotcha.
So you start.
It sounds like a lot of behavioral problems.
Behavioral problems. Yes.
Anything that we can see physically outside of that they started to lose weight? Like, is there any kind of sweating, losing teeth, or, I mean, anything? Just, I need something.
Yeah. So the sweaty, clammy look, that's when somebody has OD'd, is overdosing.
Okay.
Yes.
Okay.
And losing teeth, we do have some opiates that can cause that to happen. Methadone is one of them, because it really dries the mouth. And so sometimes people who have been on methadone, I've seen patients who have been on methadone for a long time starting to lose their teeth. Yes.
Okay.
Yeah.
Well,
And methadone is an opioid.
it's an opioid too.
Yes.
I mean, boy,
Yes.
this class of opioids is not a joke.
Yeah.
Okay. Well, I'm glad that you talked about the presentation, because I think it's about that time for us to show people what it looks like when someone is having a fentanyl overdose, right? Is overdosing, but also the good news that hopefully we can help somebody in that crisis in the moment.
Okay, so once the person's on their back, you're going to check again for breathing, and then you're going to get your phone out, and here, I will give you a phone. You're gonna get your phone out, and you're gonna dial 911. You're gonna take your phone and you're gonna put it on speaker, right? Because you don't wanna stop moving when they answer the phone. We wanna keep going on. So you're gonna look for breathing, and then you're going to get out the naloxone. So if they answer the phone, the 911 operator, you're gonna say, hey, I have someone here and they're not breathing. I'm going to give them naloxone now. We need you to come. So you take the naloxone out of the package. It comes in a package, and it looks like this. There are different kinds of them, but they all look similar. You're gonna take that naloxone and you're gonna put it on the tip of the nose, all the way up the nose, to the point where your fingertips are on their nostril, and you're gonna push it one time. You're gonna wait till it's in there, and then you're gonna push it. Now you're gonna keep looking to see if that person is gonna start breathing. Sometimes people will respond right away. Other times it can take up to 2 minutes for the naloxone to work. And this is really important because every moment someone's not breathing, they're losing brain cells. So if the person's not breathing yet, you're gonna take, if you have it, you're gonna breathe for them. Some people carry a little mask. We have them through the clearinghouse. Agencies can give them to you. But if you don't have a mask, it's okay to do this on your own. You're gonna shut their nose with your fingers, and you're gonna breathe in for them, and you're gonna breathe one time every 5 seconds. You're gonna see their chest rise, you're gonna be watching, and you're gonna do this for about 5 or 6 times. So that's about the time it takes. The naloxone should start working. If someone starts breathing, you're gonna feel it. You're gonna feel them start breathing. Someone might wake up, but if they don't, after that period of time, it's okay to give them a second dose. So what some people do is if they have a box of naloxone, they just give them all the naloxone that they have. That's not gonna wake them up any faster. It still takes 2 minutes to work, and you've just given them all the naloxone that you have on you. So wait for the period. If they wake up, they might be confused, but you want to lay them on the side just in case, because a significant number of people might throw up. You don't want them breathing that in. So you turn them on their side, and the ambulance people, they're talking to you on the phone. The ambulance is on the way. Hopefully you'll hear the ambulance come, and then you'll hand it off to people that this is what they do. And the final thing I want to say that we didn't rehearse is this is very stressful. It's very stressful to be up here talking about it. It's very stressful to do this. If you respond to an overdose, please talk to someone about it. If this happens at work, talk to your supervisor. If it happens in your family, it's really important to talk to someone about it because it can be very, very stressful. So thank you.
Special thanks to our presenting sponsor, Oregon Health Authority, helping people in communities achieve optimum physical, mental, and social well-being. And thanks to Tabiba Styles for hair and makeup glam, as well as Adorn Boutiques for my wardrobe. Situations and Conversations with Trey Renee is a Bum Juice Entertainment production. Situations and Conversations with Trey Renee. Watch Saturday mornings at 11 a.m. on Fox 12 Plus.